In the previous videos, we have looked at the symptoms and diagnosis of bladder cancer. We have looked at the treatments of both non-muscle invasive bladder cancer and muscle invasive bladder cancer. And finally, we have looked at the surgical removal of the bladder, the options for diversions, and living with a stoma. In this video, we hope to bring it all together and leave you, the patient or carer, with a positive message that although bladder cancer is a nasty and can even be fatal, it doesn't need to be. Given early diagnosis and treatment, patients can live a long and productive life even without their bladder. We should also look at the role of support groups both during and after treatment. My name is Danielle, and to start with, I have with me a consultant urological surgeon, John, a consultant oncologist, Amar, and we have 3 clinical nurse specialists. So we have Helen, Debbie and Engela, and they all deal specifically with bladder cancer patients. So I'd like to start with John. From a medical point of view, what is your message to the patient who notices one or more of the symptoms of bladder cancer?
So I think our key message is that if you notice blood in your pee, or if you see blood in the toilet bowl after you've been for a pee, or you have any concerns about your bladder symptoms, go and see your GP and get checked out.
And what's the prognosis for those patients?
From a bladder cancer perspective, the key is to diagnose the disease as early as possible. Okay, but you can be rest assured that throughout your pathway, your whole team will be looking out for you to get you the best possible outcome, and there are lots of treatment options available. Okay, so the key is getting checked out and then getting in to see the team.
Amar, after treatment and or the bladder removal and all the other types of treatment you can have, what follow-up is there and for how long does it last?
I think in terms of after the patient has finished the radical treatment, I think the early stage of the follow-up would mainly be trying to focus on the recovery of the side effects from the treatment. And as they move along, the emphasis shifts on to doing procedures to ensure that they remain clear of their tumor. For example, after radical radiotherapy, which is an organ preservation strategy, they will need to have regular cystoscopies to have a look inside the bladder, and also have regular scans to ensure that they still remain clear of the tumor. And as they move along further down the line, the focus kind of shifts on maintaining their quality of life and trying to get on with their lives as normal as they can be. In order to coordinate all of these approaches, I think there's a lot of coordination and communication, which is the key between the oncology team, the urology team, and this is mainly in part played by the nurse specialists, and the patient can have a contact. And usually the typical follow-up ranges up to 5 years post their treatment.
And John, what about after surgery as well?
Initially, the key focus will be on recovering from the operation. But once you leave hospital, you'll have the contact details of the team that are available to you if you have any problems. And we will follow you up in clinic to let you know exactly what type of bladder cancer you had and what is the likely prognosis. And that guides the follow-up. The aim of follow-up is to make sure the disease doesn't come back, or if it does come back, that we get at it at an early enough stage to be able to treat the recurrence. And ordinarily that will involve scans and clinic appointments and blood tests, and we do that at intervals out to approximately 5 years. And if at 5 years you're clear, your clinician will have a discussion with you at that point, and you may be discharged.
Okay. And Helen, was there anything that you wanted to add?
It's it is about recovery from side effects from treatment or recovery from surgery. For patients with surgery, obviously getting to grips with their changed urology, the urine diversion. I think really it's just about patients being aware that there may be multiple teams following them up and making sure that they've got the correct contact details so that they know who to contact with whatever query they've got. But clearly the CNSs are also sort of central to that in terms of being able to signpost people.
And then John, I understand that if the bladder is removed, that this can have a serious impact on the patient's sex life and sexual function. So can you explain a bit more about this?
I think, sex and sexual function is often the elephant in the room. Most of the focus throughout the diagnostic pathway will be on the cancer, and as patients, the focus will be on being clear of cancer. But it is important to remember that quality of life is important, and to some people and for some people, sex is really important. What I'd say is that there's a multitude of factors that can be involved in that. Some are psychological, and your cancer nurse specialist will always talk to you about your options from that point of view. From a surgical perspective, options are available in terms of nerve-sparing surgery if your cancer parameters are suitable, to try and improve your chances of being able to have good erectile function afterwards. From a female perspective, vaginal preservation is also something that we can do, again if your cancer parameters are right, to try and facilitate those sort of things. But the important thing is having the discussion. So do bring it up at the consultations if it's important to you.
What are the future prospects for bladder cancer patients?
I think we have shown that having chemotherapy prior to having radical treatment, either in the form of surgery or radiotherapy, improves outcomes. And I think there is further research being carried out to see if we use different agents of chemotherapy, different types of chemotherapy, whether that will improve the outcomes further. To this effect, we have done the Bristol Bladder trial, which is an in-house study in Bristol, which has shown very promising results. And moreover, there is focus being shifted on from chemotherapy to immunotherapy, and I think it is exciting to see what effect the immunotherapy might have on the tumor prior to the patients having their radical treatment. And I think in terms of radical radiotherapy, there is newer techniques called image-guided or adaptive radiotherapy, where the focus would be on trying to measure the volume of the bladder whilst the patient is having the radiotherapy, and also increasing the dose to the tumor where the original tumor was within the bladder. And so these are very exciting times, and I would advocate patients to ask if their particular centers are taking part in any research to see if it would be something that that would be suitable for them. And I think John can talk about any advances in the surgical side to improve the outcomes.
Well, I think the only thing that I'd add to that is that bladder cancer has today been under-researched, and great steps have been made in the right direction now. And, the future is going to bring great developments. From a genetic perspective, we're going to be better able to identify tumours that are at risk and better treat those tumours and target the treatments in a more personalised way. So that's what's on the horizon. But yeah, just come and see the clinicians.
Okay, thank you. So Helen, then, you're in contact with the patients throughout their journey, and what support do you offer them?
I think predominantly we try and support people get into grips with and processing all the information that they're given around their cancer and treatment options. We're a contact for patients when they're at home, or family members who may have any questions or queries outside of a consultation. They can phone us and we can chat things through on the phone, and we do a lot of that with patients. The other thing we do is we're very good at understanding and knowing what local services are around in the area that we can signpost people to, particularly around things like psychological and emotional support, so that we've mentioned previously that this isn't just a physical disease, it does have an impact on people's coping and their worry levels and their anxiety levels, and it's really important that we address that equally as we do with the physical disease itself.
And what role do the patient support groups play?
Patient support groups is another support issue, and it's peer support. So it's people meeting other people and their families who have got bladder cancer, who may be undergoing similar treatments. It's a really good way of passing on top tips to each other, and a lot of that goes on during the support groups. And it's just a way of people knowing that they're not alone with it. A lot of people, when they're first diagnosed with bladder cancer, they've maybe never come across it before, don't know anybody else that's had a bladder cancer diagnosis, and meeting other people can be very reassuring, and seeing people who've gone through treatments can be very reassuring for people.
And Helena as well, you see patients before and then immediately after the bladder removal surgery, and how important is the enhanced recovery programme and the recovery of the patient?
I think the enhanced recovery program just give you a few practical tips, things that you can do to help with your recovery, help you improve. And it's simple things like diet and exercise, which when we're feeling really low actually is the things that we don't do. The other people that post-surgery, I will phone you a couple of times after you've gone home to see how you're doing. It depends on how well you're doing, for how long the phone calls will continue. We're also on the other side of the phone. I just like Helena and her team, so you can phone us and say, I've got a problem, can you see me again? We'll try and fit you in, or we can ask your consultant about advice and tips for you. The bladder patients who has bladder reconstruction done, I see a bit more often than the stoma patients, because the stoma team picks up the stoma patients. So I'll see you when you come back for your bladder, for your catheter removal. I'll look at how you're coping with putting a catheter in yourself, bladder washouts and that type of thing. So for future, if you've got problems, I'm available. You can phone me and we'll bring you back to clinic to give you support and help as far as we can.
Debbie, you offer ongoing support to the patient after bladder removal. Do you keep in close touch with patients?
We do. We see our patients quite regularly for the first 6 weeks post-surgery in clinic, and depending on how well the patient is getting on, how confident they feel, we will start to extend those appointments, so it could go from 2 weeks to 3 weeks to 4 weeks. We'll stay in close contact with them regularly in clinics for the first 3 months, and then our patients have what we call an open appointment, which basically means that they can contact us at any time regarding anything they wish to discuss with us, or if they're having problems, they can come back and we can arrange an appointment to see them again whenever they need to. And that is ongoing. They're never fully discharged from our service. We're there for them, many years down the line if they wish to get back in contact with us.
Okay, and that follow-up support then, that's hospital or patient instigated?
Initially hospital instigated, so we'll arrange the appointments for the patient. And then once they go on to the open appointment, it's initiated by the patient themselves.
Okay. And then do any of you have a part to play in advising patients regarding the sexual situation, and with younger patients the need to consider like egg or sperm storage?
So for people who maybe haven't completed their family and who are concerned about their fertility after any radical treatment, we can offer advice and support and referral to the reproductive medicine teams to consider and talk about sperm storage and egg retrieval.
Well, thank you. I think that's a very positive message. And next we will hear from some of the patients. Now let us look at how the patients themselves feel throughout their journey with bladder cancer and how important to them are support groups. So with me today we have Alison, Barry, Elaine, Janet and Nigel. So Elaine, I'm going to start with you. Having bladder cancer must have impacted on your daily life. So how did you and your family come to terms and deal with it?
After the initial shock of being told you've got bladder cancer, we went away and obviously did a little bit of research. But to be honest with you, it's been a big roller coaster, and I'm still on the maintenance treatment, as I said earlier. You just get on with it. You just live with it and get on with it, and it doesn't have to impact your life. But obviously everybody's different. Everybody, and the support group, I went along to the support group, and it was just a massive help to know that other people, their experiences, and you can talk to them about it, and you're not alone, basically. So the support of family and friends is amazing.
And what about you, Barry, as well? You faced a similar situation, so I imagine that the support of your wife must have been very important to you.
Undoubtedly. She's been on a journey with me since 2009 with this. She's there all the time. She reminds me if I've slipped in my routines and such like. And I would only say to anybody facing bladder cancer or any cancer, to be quite honest, if you're not a partner, take a friend or relative to help, because that support is valuable, as is the local support groups.
And then Janet as well. So how did you manage with teenage children needing your support as well?
Well, my cancer journey went on for about 3 years, so it obviously did have quite an impact on sort of family life and relationships. As a mum, you want to try and protect them as far as possible and not want them to worry about me. So I was always very open and honest with them, but equally always very positive as well. I also encouraged my kids to, to talk to others if they needed to, if they were worried and needed support.
And Alison as well, how important do you think that support groups are? And at what stage do you think that a patient should join their local group?
Well, when I was diagnosed with cancer, it was all a bit of a shock, really, and it took me a few months to come to terms with myself. But at that point then, I really wanted to find other people in a similar situation, and that's for me when the support group was really important, because then you can learn from other people's experience and learn more about the illness. So I think it's really important.
What about you, Nigel, as well? How important do you think that the support groups are?
I think they're very important, quite vital to patients, especially when they've just been diagnosed, for the support and the experience they can get from people that have had the same experiences. And they can take the shortcuts without making mistakes that others made. They can learn a lot from them.
And both of you are luckily both sort of beyond cancer now. And how do you find your life now?
Well, I had my bladder removed almost 2 years ago, and at this point I can honestly say that my life feels largely very much back to normal. I can carry on doing anything that I did before. I'm, back running, and I've just been skiing, and sometimes you have to find other ways around things, but no, life, very much carries on. I don't want to stop it letting me doing anything, really.
Yeah. What about you, Nigel?
The same, 5 years ago, next month, I've been signed off, as Jonathan Ayling said in an earlier video. You can do whatever you want. I determined when I had my bladder out that I would do exactly the same. And I was away on a long-term holiday in South Africa within 6 months of having my bladder out. You can do anything you want with a bit of organisation.
And lastly, would you guys have anything to add to that about how it's affected your life?
Only to say what Nigel said, being organised. So make sure you plan well in advance. So holidays, whatever, they can be undertaken without a problem, but just be well organised.
So thank you all, and that brings this video and indeed the whole series to a conclusion. We hope that we have given you a positive message that bladder cancer need not be a killer and that early diagnosis is very important. If caught early enough, bladder cancer can be treatable and the long-term prognosis can be very good. There is a lot of support available from caring and knowledgeable doctors and nurses through to patient support groups with their buddy scheme, the buddy pack, and now these videos. After all, they know what they're talking about. They've been there, got the t-shirt. These videos are available on YouTube or can be ordered in a DVD format from www.wessexbcs.org. Thank you for watching.